Hey everybody, welcome back to the Outcomes Rocket, recording live here at HIMSS 2024. Today, I have the privilege of hosting Dr. Paulo Pinho. He is the Chief Medical and Strategy Officer at Discern Health. Dr. Pinho, thanks for joining me today.
Thanks for having me. I appreciate being here.
It's a pleasure. So before we kick things off, I'd like to just get a little better understanding about Discern Health. What do you guys do, and who's the main stakeholder that benefits from the work?
Yeah, so we're actually a predictive analytics company. We focus on high-risk patients, particularly those in the older age demographics. Really focused on clinical outcomes of complicated medical events. So, for example, diagnosis of frailty, diagnosis of congestive heart failure, diagnosis of things that lead to declines in cognition, utilization patterns in the hospital system, fall risk. So high impact things in healthcare that tend to be high cost, that can be identified, predicted, and prevented. And so that's really what Discern Health does. We're a pre-seed startup. We're about a year and a half old now. And a small growing team of data scientists and clinicians that are really focused on not only creating predictive models, but creating predictive models with explainability, which I think is really important. In terms of stakeholders, there's various. Obviously, everyone benefits from health improvement. The patient's caregivers, which are often the crosshairs of many of the challenges associated with care provision for that demographic. But then also payers, Center for Medicare and Medicaid Services, pharma, providers. So we're really kind of multi-lens in terms of our desire to improve certain, various stakeholders within the healthcare ecosystem.
Fascinating. Thanks for sharing that. And how do you layer into the workflow and the timing of that in the entire process?
So it depends on what data assets are used for particular customers. Obviously, there's data assets that are more real time. Clinical data, for example, tends to be much more real time. We're exploring even some more up to the minute data sets, things in the wearable space, et cetera, which, you can get up to the second kind of, insights, but certainly clinical data is probably the most real time, continuous data feed that we have right now. Claims data tends to, be beneficial in some regards, sometimes particularly not only with the concordance with the clinical data, but sometimes even in its discordance. There's actually some insights that can be achieved there. The challenge with that is that there's often a lag. There's often not the granularity that you need. So in terms of provider workflows, it's really about giving them insights into the fact that someone's at risk, right? So most of our models have a long tail that we're predicting somebody that's going to, progressing towards frailty in the next, X number of months or this kind of year, really to kind of intervene before they actually get down on that downward spiral, that's going to lead to their decline. Same thing with something like fall risk. Fall risk, a big precursor is things like frailty. So identifying that someone is declining so that you can say, hey, let's intervene and maybe do medication management, maybe do, correction of some of the clinical outcomes that the person has for their, chronic diseases, et cetera. So that's the way provider workflows are embedded. In terms of payer workflows, in terms of, provider organizations and hospital systems, I don't think that real time up to the minute, at the point of care is necessary. Yeah. But we're really providing that insight into, workflows, care management solutions, et cetera, to really drive that insight better for them so that you really have people that are working top of their license, to be actors within the healthcare ecosystem, to be able to exercise change and create impact. So that's the way we work.
Thanks, Dr. Pinho. And is the focus on a particular population? Are you guys focused on Medicare Advantage? Are you focused on commercial? Like, tell me about that.
Yeah. So I think Medicare Advantage is a great entry point, right? It's really about right sizing, not only the HEDIS and risk adjustment and things like that are associated with what tend to be very transactional, but really around the value-based care concept, really around the care management strategy, really creating that care journey for that individual. A hospitalization can be exorbitantly priced, right? So how do we prevent that? Readmissions, there's challenges with follow-up in patients that have, readmission risk, and the lack of follow-up in 50% of the patients within the Medicare Advantage space is huge, right? So how do we nudge those people to nudge the providers, nudge the care managers to get these people the necessary care? Because that's a huge cost for our healthcare system and only worsening, with an increased volume of that demographic in terms of patient base, but then also dealing with some of the supply issues around healthcare providers that are dwindling in numbers in today's healthcare ecosystem.
Totally, yeah. Being able to tackle those most important situations with the staffing that we have today.
Absolutely.
Makes a lot of sense. Look, we're here at HIMSS. Yeah. Why did you decide to come? Why did the company decide to come? And what's one insight that's sort of risen to the top for you these last few days?
Yeah, I mean, it's exciting. There's a lot of people doing a lot of great things. Some of it analogous to what we're doing. My philosophy is, I mean, obviously from an egocentric standpoint, I'd love to have everybody like choose us, but I mean, I know that there's other great solutions that are doing similar things, maybe even more prescriptive or more accurate in one particular disease state. We tend to have models that are a little bit more expansive. But I think what you learn from conferences like this is that it really takes a village, right? I mean, I think this model of you have an end-to-end solution that does everything, that's kind of become sort of, that's the thing of the past, right? Really looking at, the entire data value chain, like that leads to the predictive models is a huge piece of it. How you exercise an impact on, that population, the suite of products that exist to support, hey, you've identified someone that has a risk. Now, how do you deploy healthcare to that person? So you think about organizations that are doing, data access, data normalization, data quality improvement, lending that data quality to predictive models like ours, and then organizations that are able to take it to the final mile and say, hey, we've identified this person has a risk. Here's some community resources that are available. Here's some technology that's available to prevent falls or to identify when a fall happens, or perhaps call 911 earlier so that we're not stuck with somebody who has, a host of complications because they were at home, and unattended to for a day, right? So I think it's exciting to see that. And part of our strategy here is not only to share our message, where we have a booth here at 3161, we're in the Microsoft booth, but then also to really look at the best of breed solutions that are doing great things in healthcare that we could partner with, for a common strategy of helping, this very much unneeded population.
Yeah, it's a big need. You guys are doing fantastic work. For all the viewers and listeners out there, what would you leave them with as a call to action? And then what's the best place they could find you and your team at Discern?
Yeah. So, I mean, I think in terms of call to action, I think, we tend to forget that, patient centricity, is a huge part of why we're all here, right? I don't want that to be forgotten. I think that, healthcare consumer, behavior is challenging. Understanding the challenges of accessing the healthcare system in the United States is a very complex issue that affects many families. It affects patients. Let's make it so that whatever solutions we're providing are patient-centered, right? And I think speaking as a provider myself, I've seen the ill effects of burnout, the ill effects of mental health amongst providers. A lot of it is we have the necessary tools that we've learned in medical school, or our professional training. There's technology that exists there. Really be technology that augments what a provider is able to do. Provide that high tech to someone that really wants to connect with people in more of that high touch capacity. And that's where I think a lot of these solutions will exercise, their greatest impact. And so, the more that I think we can align around that focus, the more patients have to tell their story less, because the data is there. It's going to pop, right? That story is telling itself, to a greater extent. And then in terms of reaching out to us, we're available on, social media. We have a LinkedIn profile, Discern Health. We have an X or Twitter account, Discern Health. We have a website, discernhealth.ai. So feel free to reach out to us. Glad to talk to anybody that's interested in some of the work that we're doing.
Amazing. Well, folks, a lot of ways to get in touch with Dr. Paulo Pinho and his team at Discern Health. We'll leave everything in the show notes so you could get in touch. Dr. Pinho, thanks for being with us today.
Thank you for having me. Appreciate it. Thank you.